earlier sessions, we've been ASTHO and PHAB and having these collaborative 60 to 90-minute sessions, typically every 3 to 4 weeks, where we pick a topic and we set an agenda. And we've had about 4 or 5 of these already. They are on topics around typically public health infrastructure, grant collaboration, also just in general, what are programs doing at large, really across the organizations, and how can each one of us work together and sort of learn from one another. This was our next in the series. So today is the Pacific Island Culture and Traditions. And this one will be presented from the ASTHO side. So I have Carl Ensign here, who's our Vice President of Island Support, and also the Islands team. So I'll let Carl jump in, unless Melissa, you have anything to add?
No, I don't have, well, I do. I take that back. I do want to just acknowledge real quickly, we have 2 of our colleagues from NNPHI. I think Megan Wolf and April Klein are joining as well. They're another one of our FIG national partners providing TA.
Great.
That's all I have. And I remembered to hit record. So I think we're good.
Good. Okay.
Well, very good. Well, welcome everyone, and thank you for making the time and reaching out to ASTHO on this. I see a number of faces, some of whom I know very well and have spent extensive time in the islands with, like Rena Chudkar, others, and Kristen from our team, of course. Others are new to me, but I am Carl Ensign, Vice President of Island Support at ASTHO. I've been with ASTHO since 2011, but really since 2016, have been focusing on making sure that our work with the islands is relevant and strategic, working across all of ASTHO's teams. And so I'm going to turn it over to Alex here in a moment, because as we became more engaged with the islands, we realized we needed to dedicate some staff resources to kind of concentrating on making those connections. And we also found that it was important to orient staff about the island jurisdictions and continue to provide resources and ongoing support about what working with islands means. So we're going to be going over just not all of the resources we've developed, but some of those. And I realize that there's different levels of expertise in this area. So I want to acknowledge that and say that some of this will be rudimentary to some of you, and some of it will be very new, and that's okay. We're here as an ongoing resource. If I were to boil it down in my kind of odyssey of becoming more and more immersed with the islands, I think it's important to realize that we're literally, physically, culturally, contextually a world away from them. And that, if you're on an island and you're a health official or an accreditation coordinator or what have you, everything that's of immediacy to you is right in front of you. And your community, your neighbors, your friends are experiencing public health and public health challenges. And then we come in with an email and say, we can help. And it can be easily overlooked in all that is happening. And so ways to make what we're doing relevant and engage with islands on their terms and realize the enormous strengths that they have as well, I think is important to acknowledge as well. And I think you can look at the recent COVID response in the Pacific, and quite frankly, they did better than most states in terms of keeping COVID at bay and then working quickly on community follow-up and remediation when COVID did visit their shores. So I say that as context, because it's not enough to just kind of sit here and have good things to offer. I think we need to acknowledge what they're doing and the strengths they have, and then think of creative ways to meet them on their terms in their time. And that means really going there in person sooner or later. And I did have the honor of traveling with Paul Cunard recently in Saipan, and he spent a lot of time there meeting with folks. So I think we've already begun to do some of that leader-to-leader communication. So with that, I'll go ahead and turn it over to Alex Wheatley, who is our Director of Island Support, and appreciate Brian and Melissa for setting this up. And I think she's going to share her screen and just walk through a few slides.
Hey everyone, are you seeing the right side of my PowerPoint or the wrong side? The correct side. Okay, awesome. Well, thank you, Carl, for the introduction. My name is Alex Wheatley. I am the director on the Island Support Team. I'm planning to keep today's presentation pretty informal. I will acknowledge that I'm not always the best at following the chat while I'm presenting, so please feel free to come off mute and ask questions. But I'm going to run you through some of the slides that we share with our new staff, as well as some slides. We have a best practices for working with the islands presentation that we try to circulate internally as well. So to cover all my bases, I'm going to assume very limited knowledge of the islands to start. Feel free to zone out for the things that are familiar. With that, I'll go ahead and kick us off. So here you can see the greetings from each island. I think important to realize that throughout the Pacific, most folks speak a different language at home. In Puerto Rico, Spanish is critical. USVI, English is dominant, but there's also French Creole that you'll see. So we like to start with sort of welcome in all the different languages that are relevant for this region. I think it's important to start with a map. As Carl said, we are physically a world away. You can see the 2 territories in the Atlantic, that's USVI or US Virgin Islands and Puerto Rico. And then there are 6 islands in the Pacific. 3 are territories. American Samoa is the furthest south. And then you can see the 2 that are kind of stacked on top of each other. That's Guam and the Commonwealth of the Northern Mariana Islands. The other 3 are the freely associated states, which is FSM, or the Federated States of Micronesia, RMI, or the Republic of the Marshall Islands, and Palau. I'll get into a little bit more detail about the difference between territories and freely associated states on the next slide, but I think important to note the international dateline runs right in between American Samoa and the island to its left. So a different day, a different world. I can't reiterate enough what Carl shared about just feeling very far away. So the islands are not states. A couple of key differences to keep in mind. You will see the island flags flying alongside or in replacement of the US flag. Political status, as I said, 5 are territories, 3 are freely associated states. The freely associated states are independent nations that are tied to the US through compacts of free association. Those compacts of free association were created in the 80s and continue in perpetuity. The reason it's relevant is because these independent nations, sort of folks from these nations, can travel, live, work in the US without the need for a visa. They serve in the US military. The US military defends these nations as it would the US states. And there are really critical military assets in these nations, in part just sort of think geopolitical. There's North Korea, there's China, sort of these are our closest bases. So that the military sort of plays a big role in the US presence in the region more generally. In terms of US citizens, on the whole, territories are citizens, except for American Samoa, who are nationals, and that has some small ramifications, but probably not relevant for today's discussion. FAS are not US citizens. No one can vote for US president. Everyone can reside, work, and travel in the US. And there are some important differences in eligibility for federal programs based on sort of territory versus FAS status. For example, Medicaid is relevant in the territories, but Medicaid in the territories is not structured the same as in states. It's more like a block grant. So there's a cap at how much the federal government is willing to pay a territory for its Medicaid costs. Beyond that cap, the territory is on the hook for everything. The freely associated states, there is no Medicaid. And then, as I said at the beginning, all island citizens serve in the US military and actually have some of the highest induction rates anywhere in the US, higher than most states. I like to put this video in there. Just ASTHO does have an Island Areas 101 portion of our website. It's walking through how to get there on the screen now, but it's where we've really tried to condense some of this knowledge about, what are the islands, what's the relevant context you need to know to work effectively with them in health and sort of more generally. So it's all on our website. And I wish Dulce was here. She's a member of our team who created this screenshot video, and I do not have these technical skills, so I'm just kind of tickled that we can actually see this right now. But I'll go ahead and move on to the next slide for now, but that is available on the website if you would like more information after this presentation. All right, back to maps. There's a lot of information here. So I'll go back to just this for now. So you can see Pacific and Atlantic. What's important to note is just how dispersed these populations are. You have about 500,000 people spread out over this 6 US affiliated Pacific Islands. For reference, that's about 1% of California's population spread out over 20 California's worth of ocean. So definitely has ramifications for how health systems function. Also notable that Puerto Rico is by far the largest territory or freely associated state. It's also unique in that it has a pretty sizable landmass. Most of the other islands, with maybe the exception of Guam, are a series of smaller atolls. So you have these really dispersed populations. Then adding one layer of pop-ups here, the islands are not just vacation destinations. As I said earlier, the military presence is a big part of these islands' history and the US relationship with them. You have really significant issues related to typhoons and hurricanes because they are sort of ocean surrounded. Vector-borne diseases are a significant issue and look different than they do in the States. The nuclear cloud there is referencing the fact that the US does have a nuclear legacy in the Marshall Islands, which is really important to remember. It continues to define some of our engagement with them, especially as the compacts of free association have been in the news recently. And then you have fisheries and tourism as the primary economic drivers. And then all of those health indicators that you can see in the blue bar. The last piece I want to flag is just looking at the census data from 2010 to 2020. Another trend across the board, outmigration. Folks from the islands are moving elsewhere for opportunities, for better healthcare. And I think that dynamic is important to keep in mind as you think about, and remember that these islands are geographically isolated, but not isolated from the broader US sort of healthcare system and other sort of the broader US, I suppose. Okay, I know I'm covering a lot of ground, so I'm going to quickly check the chat to make sure I haven't missed anything so far. I think I'm in the clear. Okay.
So Alex, this is Melissa. I have a quick question as you were talking about the population decreasing. Are they, do we know where they're moving? Are they moving primarily to the States or elsewhere, or a mix?
A mix, but there are significant populations in the US. I actually have a map on the next slide. You can see the Pacific is primarily moving to the West Coast. And then the Atlantic, there are big populations in Florida and New York. Yeah, in terms of where they're moving, there are huge connections on island to more local places, like the Philippines is a huge portion. Migrant workers from the Philippines is a huge part of the healthcare system in Guam, for example. But I think outmigration from Guam is more easy to the US just because there are all these benefits associated with being a US citizen or having the FAS association.
Thank you.
Yeah, no problem.
Yeah, just real quick to add to that, there is some opportunistic movement too. Marshallese have been heavily employed in the meat packing industry in Arkansas. That's why you see a large Marshallese population, oddly enough, in Arkansas. So there is some pull with respect to available employment opportunities as well. I think it kind of varies by island, the migration patterns. There's also some migration of the FAS migrating to territories for education and work opportunities as well.
Right. Of course, landscaping is happening right now. So if you have any issues hearing me, please just put a note in the chat and I'll get closer to the mic. But moving into a little bit more health context, chronic disease is an urgent issue in the islands, especially in the Pacific. The Pacific has some of the highest rates of obesity in the world. And I think an important element of that is the legacy of globalization. So, you know, the islands are geographically pretty isolated. As they've been brought into the global economy, that's brought new foods and new products and a reliance on cheap imported unhealthy foods. You can see a photo of the aisle of Spam at a grocery store. I think I actually took this in Guam. And just sort of that element and sort of the remnant from significant military presence in terms of Guam, in terms of Spam and white rice, are a component of this discussion around chronic disease. Also relevant to note the impact on food security. So you can see the two images there of big storms that the bottom one is the storm that went, actually both of them are the Atlantic. No, top is Atlantic, USVI and Puerto Rico. When Hurricane Maria hit, Puerto Rico was importing 85% of its food and USVI was importing 97% of its food. So important context to understand as you think about nutrition and healthy lifestyle. The bottom one, that little pink item there is Guam and CNMI in the midst of a massive hurricane that hit earlier this year and took out Guam for a couple of weeks in terms of communication. Moving to infectious disease. Again, there's a legacy of globalization here. The outsiders have long introduced devastating diseases to island areas. And I think that history loomed large, especially during COVID, which I'll get into on the next slide. But a few examples of disease burdens that are important to the islands, but maybe less important for the mainland. Tuberculosis has a much higher incidence in Pacific Islands relative to the US. For example, RMI had a recent incidence of 422 cases per 100K, whereas the broader US rate is 3 per 100K. You have dengue, which is a mosquito-borne disease, and there has been an ongoing outbreak in RMI for a little while. Hansen's is leprosy. It has not been fully eradicated in the US API. And then you have Zika, particularly in the Atlantic. I know the Zika outbreak made national news in 2016, but it's been a bigger and longer issue in the Atlantic. Environmental degradation, you can see the tires and the tank in the photos. Land use is a huge challenge for the islands, including how they handle water and how they handle waste. Important to keep that in mind. You can see in the top right, that's a t-shirt from an elementary school in RMI. I mentioned earlier the nuclear legacy. So the US conducted 67 nuclear tests in the Marshall Islands between 1946 and 1961. Some islands are still unlivable due to high levels of radioactivity, and cancer incidence in the Marshallese population was elevated in the decades following testing. There were special programs to care for victims of nuclear fallout, the last of whom passed away a few years ago. This chapter of our history looms really large in the US's relationship with the Marshall Islands. March 1st is an official holiday that honors the victims and survivors of nuclear testing. So I think important to have that context as we work with Marshall Islands. All right. Carl mentioned earlier the COVID-19 response. Just very briefly, as Carl said, the island responses were different from the states and sometimes more effective. I won't read through everything on the slide, but I think interesting to note the Pacific, the islands actually closed their borders for years. They switched just chartered flights, repatriating their citizens, and that was effective in keeping out COVID. FSM and RMI didn't see COVID on their shores until summer 2022. So it was a very different experience than a lot of the states. There was also sort of, because of maybe that history of outsiders bringing infectious disease, there was a lot of political will to support this and a lot of sort of unified action around vaccination rates. And the islands have had some of the highest vaccination rates. So I think just important to acknowledge sometimes this is an example of sometimes the health dynamics looking very different in the islands relative to the states. All right, I think this is maybe the last slide I'll do from this slide deck, but we talked about it a little bit earlier. I think the takeaway is just that these regions are far away, but they're not isolated. There are huge US API and Caribbean populations in the broader US, and these migrants have significant and sometimes distinct healthcare needs. So even as we work with states, we keep in mind sort of the best way to help states support these populations and their unique challenges. And the cultural competency that might be required to support them. You can see some of the items from COVID-19. Hawaii had special outreach events for Pacific Islander populations. Guam broke down their data to identify what Pacific Islander populations, sort of more specifically, it's not a monolithic group. So what did FSM migrants in Guam look like versus RMI versus American Samoa, sort of breaking that out. And then you can see the Woven with Elders toolkit was actually created by a Pacific Islander-led organization in Oregon and was adopted sort of throughout the West as an effective messaging tool for Pacific Islander elders in their communities. All right, I will actually do one more slide, which I think is just in terms of how and why ASTHO works with the islands, and my team in particular. It's really driven by health equity. Relative to the states, the islands have had health system development their health system development has been significantly impacted by systemic underinvestment and colonialism, both past and present. And I think that history needs to be acknowledged. There are significant health disparities affecting this region and between islands in this region. Sometimes we don't know the extent of the health disparities because the data capacity isn't always there. And even if the capacity is there, sometimes the data isn't included in national data sets for a variety of reasons. But it just means that some of these disparities are effectively invisible. So there is need to sort of raise awareness of these gaps. And then I think the mismatch there, sort of the takeaway is that, you know, sometimes there needs to be some additional support to translate support structures that were built for states to ensure that they make sense and resonate in an island area context. So ASTHO strives to work with all of our members, states, territories, freely associated states, and Washington, D.C. So with that, I'll pause for questions. I'm going to switch to a different slide deck and start talking a little bit more about, given all this history, best practices for working with the islands. But does anyone have any questions for now as I pivot? Right. Hearing none, I've either done a great job of explaining or I'm talking way too fast. So let me know if it's the latter. But for now, I'm going to pull up my other slide deck, which is best practices for working with the territories and freely associated states. Are you seeing the correct side of my slides again? Carl, I'm looking at you. Okay, perfect.
Yep.
Sweet. Okay, so I'm going to skip through the first couple slides because we just walked through some of this. But this is an internal slide deck we've made to help ASTHO staff work with the islands productively. There are some differences that can be helpful to keep in mind to sort of build productive relationships. I'll start with a glossary of terms. Hopefully, I've explained my acronyms enough that none of this is new, but territories are different than freely associated states. The compacts of free association are what tie the freely associated states to the broader US. Insular area is a word you might see thrown around, especially by the Department of the Interior. We don't use this term. It doesn't actually include Puerto Rico. We use island area or island jurisdiction. And then US affiliated Pacific Island or USAPI refers to the 6 islands in the Pacific. This one, not so relevant, given you all aren't at ASTHO. I will move then to just some best practices. So at this point, I do encourage folks to come off mute if they have questions. I'm just going to run through some of the context of if you came to me and were like, hey, I'm trying to work with Guam, what do I need to know? This is how I'd walk you through it. So first, time zones. Huge issue. That date line cutting off just next to American Samoa means that 5 p.m. today is tomorrow morning for most of the Pacific. So if you're scheduling meetings, 6 p.m. is probably going to work better for the Marshall Islands, but it's not going to work well for Pennsylvania. So you need to sort of think through ways that you can address both audiences. Maybe it's separate meetings, maybe it's recording and sharing it later, but being aware of that time zone, I think, is really important. Same thing with languages. English is the business language in most territories and freely associated states, but you need Spanish for Puerto Rico. ASTHO has a master service agreement with a translation and interpretation service based in Puerto Rico, and that is really important for clear communication and for building trust. Last thing that I think will be familiar is federal program eligibility differs. I talked about that with Medicaid. I flag it just to acknowledge, sort of check assumptions about what federal programs might be applicable in the islands before you go in and start talking about, well, you could use HRSA funds for this, or you could use, they don't always have access to the same funds, unfortunately, and sometimes they have access to different funds. So checking those assumptions, I think, is a good starting point before working with the islands. All right. This next one, I talked about it a little bit in terms of the data and the disparities. So timely and consistent data are often not readily available in the islands. They're not available at a local level, a regional level, a national level. In terms of how you might work with them, it might mean they need extra support and extra time for data and reporting structures. And there might be extra prep required to make sure that they can function in a way that meets the needs of whatever funding you might be passing through or whatever TA you might be trying to offer. They also lack financial and administrative capacity relative to states. So it's just sort of that business process side of things. You'll need to be a little bit more hands-on with the islands for the most part. I think best practices are build in some extra time for invoicing and paperwork, expect that you'll need significant follow-up. They just don't, A, they don't have enough people. These are really small health agencies. And B, we feel a world away. And C, the capacity just isn't always there. So keeping that in mind as you work with them. Similar, expect technology challenges. On the whole, I think on average, being on video is not the norm, especially in the Pacific. So expect limited video. Often that's due to limited bandwidth. And just be patient. I feel like we often have a plan A, and if plan A doesn't work, we call via WhatsApp, or we call via something else, or we just go via email. Sort of be ready to pivot, be ready to be a little bit flexible. As I mentioned, small health agencies. So the systems are underdeveloped and most staff wear many hats. I think the key takeaway for that is just never assume disinterest or malintent. It's probably just that they haven't seen it or that they haven't had a chance to fully think about it. They really do. Island staff, more so than the states that I've worked with, are pulled in so many different directions that sort of that extensive follow-up goes a long way. State expectations for communication norms at the beginning and also follow through on those. Don't be afraid of pretty significant follow-up, which I have a slide dedicated to later. Also, phone calls. They are it's way different. Phone calls are by far the best way to communicate. They go a long way. You're going to get a response much quicker. Don't be afraid to pick up the phone and call. And I have some guidance on calling territories. It's like a state versus freely associated state, which is an international call. I'll highlight that last bullet there. Just WhatsApp is a texting app that is really popular, especially in the Pacific. When a good way to make sure you keep in touch with folks and are able to get messages through, identify whomever your champion will be for a given project and get their WhatsApp contact. That's a good way to, if you're not getting responses via email or you can't connect via the phone, a quick message via WhatsApp is often the most effective way to get in touch. All right. As we've talked about, the states feel really far away and extra effort might be needed to make your project feel relevant locally. So things that are like, oh, all the states are doing it, we're getting this national data, it won't resonate as much. I think taking some time to really think through how can this fold into local strategic plans? How can this align with other things that you know they're already doing? Or if you don't know what they're doing, talk with us, talk with other folks to see, hey, what are your touch points? How can we leverage those to sort of make this feel more relevant locally? I think it's also helpful to build a personal relationship with staff, more so even than with states. Having sort of a regular touch point, having that personal connection can help make a project feel more relevant. And then we like to say, if you know one island, you know one island. They are all different. They have unique histories. They have unique cultures. They are very different. So we talk about the island areas as a group, but it's important to remember that as you work with them, they are definitely different entities and you want to know the relevant context for each one. And I know it says ask us. You're welcome to ask us. I know we're not with your organization, but like, I'm happy to be a resource. If you have questions, feel free to reach out. We want to just help folks work with the islands and really build up their capacity, address those health disparities. Okay, I'm wrapping up. I think I have just a couple more slides, but I talked about significant follow-up. I won't read everything on the slide, but this is significant follow-up. This is not excessive. This is the norm. It is very different than I think the norm with states. So sort of accepting this as sort of a standard operating procedure as you work with the islands takes a little bit of mental gymnastics, but I think once you get there, it's helpful because then it's just like, ah, yes, I haven't followed up 3 times. Of course, I haven't heard anything. Weird, but effective. So I wanted to actually lay out a process to help show what significant follow-up might look like. And again, you're not at ASTHO, but if you are having issues, feel free to, if we can help leverage our connections, free to do so. Okay. And as I'll highlight again, don't be afraid to call. Phone calls really go a long way. On that note, international calls. So calling a territory is like calling a state, no special considerations. Calling a freely associated state is the same as an international phone call. So you do need to dial 011 to acknowledge international, and then the phone number. WhatsApp is free if you're connected to Wi-Fi. So sometimes we say, if you're going to be calling the FAS and it would be otherwise from your cell phone, call as an audio call through WhatsApp so that you don't incur those international charges on your cell. In terms of scheduling, I put our favorite time zone converter on there. I think one reason it's helpful is because not all the islands do daylight savings. So the time difference actually shifts depending on what time of year you're in. So just when you think you've got it straight, it changes. So this website allows you to put in a date in the future and it'll tell you what the time is at that point. So it is good about daylight savings. It is, I would die without it. Love it. Also, I don't think you have access to our internal calendar, but for awareness, islands do celebrate some different holidays than the states. So if you're looking to schedule a big convening, it's worth a quick Google to make sure that it's not FSM Independence Day or something. So just keeping that in mind. Actually, I think that's everything. This is ASTHO specific. So this is my quick summary slide of everything I've shared in this second presentation. I will leave it up for now, but that is the end of what I had hoped to share with you all. Happy to take questions, and I'll pause there. Thanks all.
I guess I also want to acknowledge that Rena, as I remember correctly, served in the Peace Corps in the US API on a very under-resourced island. So you also have in-house expertise as well. Kiribati, yes.
Kiribati, I'm jealous. I want to go.
A great place. Happy to give you tips if you do.
So Carl, there will be, and Alex, there will be a few of us that may be attending the summit in late January, early February. And I looked briefly at the agenda and noticed that there was a welcoming ceremony and then a closing ceremony. And I was wondering if you could speak to that a little bit. Is it like our typical welcome and introductions, or is it truly something more ceremonial that they do in large convenings like this?
Yeah, I mean, excellent question. And we are supporting Lindsay and Sepoy and Emily as they plan that convening, and are strategizing with them on a number of points in the agenda. You certainly cannot underemphasize the importance of sort of traditional ceremonial introductions. The islands have sort of, you know, the US affiliated leadership, and there's also traditional elders. And oftentimes when we go to meetings, there's a formalized introduction from elders who have great sway in terms of island norms and responding to public health programs and activities. So I'm glad you brought that to my attention. I think we're really trying to push that the island should be front and center on this. We want to avoid sort of, here's our Western model and it's great things and you should adopt some of these, but rather provide the opportunity to hear about what they're already engaged in. Again, I go back to the COVID response. The states can learn so much from what the islands did. So I think it's very important that we go in and give them the time and space to introduce themselves and the work they are undertaking with regard to infrastructure enhancements and also where their gaps are. So I think we've been primarily emphasizing that theme and not sort of the ceremonial introductions, but we probably shouldn't give that short shrift. Thank you.
And I'll add real quick as you process Carl's point about hierarchy. I think it is really important to give space for the governor or the health official to really kick things off, especially since we're visiting their island. And hierarchy in general is a little bit more relevant in the Pacific. I think if you're working with the Pacific, giving space for the most senior person in the room to speak first is a norm. So hierarchy is something to keep in mind for communication. I think something I've also seen in presentations or in convenings in the Pacific that I don't think is happening in ours, but oftentimes they will start with a prayer. I've heard it described as a missionary-based culture. So missionary faiths like Catholicism are pretty big. So I wouldn't be surprised if there's a prayer somehow, some way. I also want to acknowledge the conversation in the chat about misinformation. Yes, actually, interestingly, the dynamic that we saw during COVID-19 is that there wasn't misinformation coming from state-based Pacific Islander populations. I remember Secretary Jack Niedenthal from RMI reached out to ASTHO and said, hey, our state-based Marshallese populations are spreading this misinformation that they've heard back to the island, and then we're dealing with that effort. It's not sort of organically growing locally, it's from the state-based communications. So yeah, I think less misinformation on island, but just as much ended up getting pulled into the conversation from that diaspora.
So I have another question because I'm thinking just about general interactions as well. So when you're introducing yourself or meeting someone for the first time, can you talk through what that looks like if it's different than how we might do a typical handshake here in the States?
I think it's pretty similar, actually, with the
Okay.
folks that you'll be engaging with. It'll feel like working with the state's
Okay.
introduction. Good question.
Mhm. I mean, I guess the other thing is they're used to Westerners coming in and saying hello and shaking their hand. There might be different ways they interact, with their peers and their community, but it's not as if you're breaking norms by adhering to your cultural context. I tend to err on the side of using formal titles, especially initially. There's this kind of push and tug. It seems to be very collegial and community oriented, and everyone's kind of on the same page. And yet the more you delve into it, you realize that there is a structured hierarchy for a reason, that's very important contextually and traditionally. So the more I become known, the easier it is for me to kind of step on some of those cultural norms and approach someone at a lower in the organizational chart, tell them about an opportunity, invite them to participate, say we can, travel them, and then the health official gets wind of it and may react negatively to that. So I think it's important to keep that in mind, that there very much is a hierarchy that's very important in terms of functioning as a community, and that we shouldn't run afoul of that too much.
Yeah, and me again. What kind of impact does that have when you're working with them? I'm thinking about the hierarchical structure and the most senior official typically being the one who speaks first. How do you ensure that the other voices are heard? Because I would suspect that that has some impact on those that are not at a senior level, maybe feeling like they can't speak or that they don't have a voice. Is that an issue that you have run across?
You know, and I'm so much a white male here, so who am I to tell you the answer to that? And Rena, you might actually have some interesting, I mean, since you lived in the culture for so long, you might have some interesting insights. My experience is, as long as you acknowledge the hierarchy and are respectful of that, then you can move forward. It's just kind of when you blow past that, that you can break some cultural norms that are pretty immutable. So in answer to your question, you may pose a question to the group and there's absolute silence, and that's okay. Just sit in the silence. And usually you can direct it to the most senior person, or someone at a lower level will. Once they've spoken, get the conversation started, then others chime in.
There's a question in the chat. Are there differences or similarities between the public health infrastructure of the different islands versus the USA that would be helpful for national partners to be mindful of? Carl, do you want to take a first attempt at this, or would you like me to?
I mean, that's such a big question.
Great question.
Yeah, it is. I do think it's kind of important to acknowledge that if you travel to Guam, you'll say, huh, this is different, but there's a lot of similarities. They have street lights, they have art infrastructure, they have, for the most part, potable water, electricity works, et cetera, yet there'll be things that are just different. You'll see tourists, for instance, that we're not used to seeing in our country because of the close proximity, or aid workers coming from New Zealand or that sort of thing. So say, well, this really isn't that different, but it is different. If you go to a freely associated state or a place like Kiribati, it's very different, very challenged in terms of infrastructure. And you can't really take anything for granted. I mean, I've been to hospitals that don't have a sanitary water supply, for instance. So hemodialysis is not available within the jurisdiction. There was a slide back there of folks carrying water. I mean, that's because through reverse osmosis in Ibai, which is one of the most impoverished islands in the Pacific, there is a centralized water source that's available through reverse osmosis, but running water that's potable is not available in homes or buildings. So, you know, it's kind of a journey. Or you get to we don't really call them outer islands anymore. We call them neighboring islands because we're trying to get away from this mainland outer distinction. But when you go to some of the neighboring islands, again, it can be very basic in terms of infrastructure. You're really thinking about a second or third world country, if you will. So I don't know if that's your question or answer you were looking for, but that's kind of the thing that always strikes me.
And I can add my 2 cents, which is, I think one of the big infrastructure differences that I've seen is that public health and acute care are a little bit more closely tied. They might, public health might be based out of the hospital, and there might only be one hospital in the territory. So there is a little bit more opportunity for cross-cutting services. And I think islands, that is one of their strengths, is some of that integrated public health and acute care. Another element, I don't know whether I'd call it infrastructure, but something that we've seen recently is that health equity is a much newer concept in the islands. State-based discussions about health equity don't always resonate. And part of it is the language, sort of health equity versus sort of access to resources we've heard is a more resonant description, but also sort of the perspectives that are sort of naturally highlighted in the US. I think we hear about the experiences of like certain migrant groups, of Black folks, of Hispanic folks. And then in the islands, you have a very different demography. So it's, you know, Guam's primary population groups are sort of native Chamorro people, Filipino migrants, other East Asian migrants, and white. So a health equity description that really centers the experience of sort of the Black and brown folks that are in the US states isn't going to resonate. So I think having that context as well is also potentially helpful. April, I see your hand is up. I'll pass the mic to you.
Hey everyone. Yeah, also former Peace Corps volunteer in Ghana and experienced the same thing in terms of health equity. When there's less racial diversity in these places, it just doesn't kind of resonate the same way. But I have a question related to the current conversation about infrastructure. And if you can't answer this, totally understand. But I'm curious what the structures are for like public health education and training in some of these islands. Like, where does that come from? Like, are there educational programs and colleges that have trainings, or is a lot of this coming, people like the diaspora coming back with this experience? Because I think that's really helpful for the context that we're working in this space as well. If you know anything or share anything about that.
You can go first this time, Carl, and then I'll pass the mic to you. In terms of public health education, there are sort of University of Guam, the CNMI Community College. I think those academic partners are a big player in some of those conversations. A lot of public health education is done through the health department. Again, some of that integrated with the hospital means there are naturally more opportunities to educate while folks are in the hospital for various things, or sort of doing their primary care visit just down the hall from the ER or something. I'll also say that there are some national partners or some regional partners that are really valuable. PHOA, the Pacific Island Health Officers Association, is a critical resource. They also have WHO or a group called Pacific Community. I think those are good groups. One area that I think sector that's a little bit missing is community-based organizations. There aren't as many as there might be in the States. There are some, and the ones that we work with are really valuable. But on the whole, I think if you put out a bid for a community-based organization grant, you might not get 20 responses, you might get 3. So just sort of being aware of that sector. The last group I'll mention is just faith-based organizations. Religion is big, and I think faith-based folks are really trusted messengers, and folks have seen success passing public health messages through churches or through traditional leaders. I think those are both important. So with that, I'll pass the mic to Carl. Anything to add?
No, I don't think so. I think every jurisdiction does have an institution of higher learning. And then the territories generally have both a community college and a university. There is a fair amount of emphasis through PHOA and others focusing on the pipeline. And there's acknowledged need to work on that, just as we know we need to work on it stateside. So that's kind of in its nascent development, I guess. But no, I second everything you said.
The last thing I'll say is just, I've heard a lot about radio. If you listen to the island, if you're on the island and you're listening to the radio, there are a lot of public health and governmental broadcasts that just happen over the radio. So that's another element.
And Marita had to open the can of worms about the military public health systems. That's a huge issue. If you go to Ebai, Ebai is where all the Marshallese are forced to live. They serve the Kwajalein Atoll, which has now been entirely taken over by the military. The entire atoll is a military installation, so the Marshallese need to come every morning and leave at night every day. Kwajalein has a first-rate medical facility, has a golf course, it has everything. Ebai, the differences are stark. And no, a native Marshallese cannot access military healthcare. That being said, with the COVID response, and especially the Roosevelt having to, Guam was the only one that would take them in when the USS Roosevelt had a COVID outbreak, and basically housed the entire ship in hotels and cared for them in the hospitals and that sort of thing. There's a growing recognition that in places like Guam, that having separate labs and separate hospitals and separate healthcare systems really doesn't work when you have, a third of Guam's land dedicated to military installations. There's obviously going to be overlap between civilian and military populations. And from a population health perspective, it's unworkable to force families and individuals into separate slots. So The walls on that are beginning to come down, I think. But the military presence in the islands is at one point in time a source of pride, and a blatant acknowledgement of the colonial history that these islands have suffered. I don't know how to state it anymore.
That was well said. That was well said, Sarah.
And it's very much a work in progress. And we have had several meetings with military envoys out there. PHOA has as well. They have a very rigid way of doing things. They're realizing they need to change. It's beginning to change. There's a lot of work to be done there. I'll just leave it at that.
Yeah, I don't have much to add. I think one thing we've looked into is there aren't a lot of services available to veterans based in the islands. And we've said, oh, well, maybe military-based public health systems could serve veterans as well as active soldiers. And the feedback we've gotten is that it kind of depends on the base commander. Technically, serving vets is not the mission of the base. So as Carl said, it is a pretty rigid, specific to the mission, public health focused system. So it sometimes works with island public health systems. For example, the National Guard administered vaccines in Guam for COVID-19, but it varies. So I think that's all I have to say. In terms of military engagement in general, I made one note. I think the islands where the military presence is strongest is RMI, Guam, and Puerto Rico. So military relevant everywhere, but especially in those three.
We do have a question about considerations of hard copy resources. I'm not quite sure what we're driving at there. I mean, I think the islands are fairly advanced in terms of electronic documentation exchange. Bandwidth can be a real issue, especially in the freely associated states. So I don't know if that helps.
Yeah, I think I'm a fan of hard copies as well as virtual copies of stuff. And if you're doing a site visit, I think it's helpful to bring the hard copies of stuff you'll need. I've been told that that's sort of, don't plan to ship things ahead of time, they may not arrive. So bring hard copies and other stuff with you, and also be prepared to be able to host a site visit or etc. without internet, because sometimes the internet will just go down for a couple days. And that can be in the way if you're relying on it. So hard copies can be helpful in terms of avoiding too much of a reliance on internet, especially if you're in the freely associated states or a neighboring island.
And really though, Alex, I have to caution that extends to any jurisdiction. We've had internet problems in Guam, we've had them in Puerto Rico, American Samoa. It frequently goes down when it rains, interestingly enough. So it's more than just the freely associated states. I mean, I think one can build that in. One just needs a backup plan if the internet goes down.
I know we're about at time, so I will stop the screen share. Happy to keep taking questions, or Melissa, Brian, maybe I'll pass the mic back to you all for any concluding remarks. And thank you all for the questions and for the discussion. It's been really wonderful to chat with you all. Glad you all made this space, so thank you.
Thank you very much, Alex and Carl. It was very good. Appreciate the time that you made to join us today. With that, I don't have anything else on the agenda. Melissa, is there anything else you want to cover?
Not agenda-wise. I will say thank you, but I did notice that there was another question that Lydia put in the chat. It was mentioned that English is a working language, but would it be helpful to have in other languages any written documents? Is that necessary or helpful?
Often the issue is that we don't have capacity to translate that locally. It would be something like we need it in Chamorro, and that's not as easy to find for a group based in DC. So it might be helpful. ASTHO hasn't found a way to accommodate those requests yet, but if you do get those requests or are able to pass through funding to support Guam in translating their materials into the local language, that can be helpful.
Thank you. Well, I'm seeing a lot of messages, how helpful this was, and informative, and on behalf of PHAB, I know, and I'll say on behalf of NNPHI as well, thanks for doing this for us, and thanks for continuing, offering to continue to be a connection for us as we expand this work. It's very helpful.
Happy to help and always glad for more island champions.
Great.
All
Well,
right.
everyone, I
Well,
think we're good.
Good.
yeah,
All
thank
right.
you all. Happy holidays and look forward to partnering.
Yep.
Good.
Thanks,
Thank
y'all.
you,
Great
everyone.
holidays. Take care.
Thank you all.
Bye-bye.